Medical coding interview questions for freshers. 1. General medical coding interview questions. What is medical coding? Medical coding involves converting healthcare diagnosis, procedures, and treatments into standardized codes for billing and record keeping. What are CPT, ICD-10, and HCPCS codes? CPT current procedural terminology codes represent medical procedures. ICD-10 International Classification of Diseases codes represent diagnosis. Each CPCS healthcare common procedure coding system codes are used for medical supplies and services. What is the difference between inpatient and outpatient coding? Inpatient coding is used for hospital admissions, while outpatient coding is used for procedures and treatments where patients are not admitted. How do modifiers work in CPT coding? Modifiers provide additional information about a procedure, such as whether it was bilateral repeated or altered in any way. What is the purpose of ICD-10 codes? ICD-10 codes help track diseases and conditions, assist in healthcare research, and ensure accurate medical billing. What is medical necessity in coding? Medical necessity means that a procedure or service must be justified based on the patient's condition to be covered by insurance. What is the significance of HIPAA in medical coding? HIPAA Health Insurance Portability and Accountability Act protects patient health information and ensures secure medical billing practices. How do you stay updated with changes in medical coding? I follow AAPC and AHIMA updates, take certification courses, and enroll in clinical research training programs. 2. Anatomy questions for medical coding interview. What are the different planes of the human body? The sagittal plane divides the body into left and right halves. The frontal coronal plane divides it into front and back. The transverse horizontal plane divides it into top and bottom. What are the types of muscle tissues? Skeletal muscle, voluntary movement, smooth muscle, involuntary. Found in organs, cardiac muscle found in the heart, which organ produces insulin. The pancreas produces insulin, which regulates blood sugar levels. How many bones are in the human body? The human body has 206 bones. Which bone is the longest in the human body? The femur thigh bone is the longest and strongest bone. What is the function of the liver? The liver detoxifies chemicals, produces bile, and helps in metabolism. Where is the pituitary gland located? The pituitary gland is located at the base of the brain and regulates hormones. What is the difference between tendons and ligaments? Tendons connect muscles to bones, while ligaments connect bones to other bones. 3. Physiology questions for medical coding interview. What is the function of red blood cells? Red blood cells, RBCs, carry oxygen from the lungs to tissues and remove carbon dioxide. How does blood flow through the heart? Blood enters the right atrium, moves to the right ventricle, travels to the lungs, returns to the left atrium, and is pumped out through the left ventricle. What is the function of hemoglobin? Hemoglobin binds oxygen in red blood cells and transports it throughout the body. How does the respiratory system function? The respiratory system takes in oxygen and expels carbon dioxide through the lungs and alveoli. What are the different types of white blood cells? Neutrophils, lymphocytes, monocytes, eosinophils, and basophils. What is the primary function of the kidneys? The kidneys filter waste, regulate electrolytes, and maintain blood pressure. How does the nervous system transmit signals? Neurons send electrical and chemical signals through the synapses using neurotransmitters. 4. Pathology medical coding interview questions. What are the different types of anemia? Iron deficiency anemia, sickle cell anemia, and pernicious anemia. How is diabetes classified in ICD-10? E10 for type 1 diabetes, E11 for type 2 diabetes. What is the difference between benign and malignant tumors? Benign tumors are non cancerous, while malignant tumors are cancerous and can spread. What is COPD? Chronic obstructive pulmonary disease, COPD, is a lung condition that makes breathing difficult. What are the different types of fractures? Simple compound, comminuted, green stick, and spiral fractures. How is hypertension coded in ICD-10? I10 for primary hypertension, I15 for secondary hypertension. What causes kidney failure? Diabetes, hypertension, and infections. Thank you so much watching my video.